and I would like to welcome Martin Kruse from Copenhagen Institute for Future Studies to present the lab. So Martin, floor is yours.
Thank you. Thank you very much. So the BAPEMED Lab is about selecting strategies for the future to create a more resilient healthcare system. And why do we do that? Well, basically, as many of you probably know, we're in a situation where around the world, but in particular in Europe, we've seen the share of healthcare as a share of GDP is increasing. So that means the burden for society is just getting bigger and bigger and bigger. And that means if you extend those curves, at a certain point, you will need to decrease military spending or spending on sustainability or other issues. So this has been something that has been going on for a long time. So we're already seeing some of the signs of this, the fact that governments are not able to keep up the service levels in some areas. So we have the burden, and the burden is really around the fact that we have a demographic change. So we have more old people, but we also have an increasing burden of non-communicable diseases, which is like diabetes and other healthcare-related issues that we're facing. So in Bulgaria, there are particular things that are specific for Bulgaria, but the main issue is really something that we are facing across Europe. So the main, so in terms of Bulgaria, some of the key issues here is that, along with many other countries, there's a lack of focus on preventive care. So the entire system is really built on you get sick, and then you go to the doctor. There's no incentive structures put in place where you try to prevent people from actually getting sick. There's no financial structures or anything else that is developed to do this. Even though a lot of surveys show that we could reduce a lot of cost if we did that. So there's also the fact that you have in Bulgaria you have not particularly well healthcare data. Data is not shared among different actors in society, and you don't have the regulatory framework to do this either. And you have a lot of political issues, and you have among the public, you have a total lack of trust in politicians and them being capable of doing anything about this. So basically, what we do, we did the first workshop where we looked into some of the issues. So we tried to figure out, so what are the actual problems in Bulgaria? How do the different stakeholders, how do they interact with this, and what are their barriers? And trying to figure out what are the overall trends in society and what is specific for Bulgaria. And based on this, we will develop a couple of scenarios. And from those scenarios, we will identify policies that could work as a response to those scenarios. And we will take policies from the knowledge base, and we will test those in a wind tunneling exercise, which is basically a way to make sure that you get the a robust strategy that works across different futures. Fundamentally, for futurists and people working with foresight, is that we don't believe that we can predict the future. Rather, what we do is we create more scenarios so that the strategies that we create, the policies that we create, should hopefully work in several. That way, it's more robust. And after that, in the end, there's a learning assessment of the outcome. So that's basically the methodologies that we're going through and the different kinds of work package steps that we're moving through. So we're working with the Bulgarian Association for Personalized Medicine, and they have created they have facilitated a large network in Bulgaria, where we work with both government officials and people, different kinds of NGOs, universities, and so forth. So what we provide is the methodological expertise within foresight. So we've been working with foresight for more than 50 years, but we also have a specific competence within healthcare, because we've been working with that for governments in all around the world for a long time. So we kind of have a double role here to play. So yeah, why future resilience? Well, governments are facing, as I said, they're facing a crisis, and it's one of those crises which is predictable. I remember back 20 years ago, when we were looking into the aging of society, we were like warning, okay, aging is coming. Maybe you should actually try to have include that in terms of how you change pension systems. And politicians, as you know, were really, really slow to do that, even though this was absolutely predictable. And this is also one of the crises which is absolutely predictable. We will run into it, and this will hurt us. So this is why we're doing it. And so we try to create resilience by making people aware of the crisis that we are facing, and hopefully that will make it easier for us to prevent it. Thank you.